Alrighty then. Before I begin, I want to thank a few people for all of the help and for their sharing spirits. Thank you to Patty for giving me the opportunity to practice doing webinars and expanding my skill set and knowledge base. You are giving me an opportunity to help me make this my best year ever. And to both Melody Licht and Cassandra Centauri for their time and input on these presentations. Without Melody taking the time to record this presentation through Camtasia, I would not be able to share this video on my website or on my Facebook page. Both Melody and Cassandra have been helpful with all of the recent technology changes going on in my website and content delivery. So hello everyone, and thank you for your time and attention. I know you lead busy lives and you have so much going on, but that's why learning reflexology can really benefit you with your health goals and to help reduce your stress. Let me take a moment to introduce myself. My name is Kay Lowell. I am a holistic health educator and practitioner, and I own Spiritual Health and Wellness Center, which is located in San Antonio, Texas. I teach people to use safe, natural, non-invasive techniques to reduce their stress and increase their sense of well-being. My classes are approved for continuing education hours through the NCB-TMB for massage therapists and other body workers. I primarily focus in the area of Reiki, reflexology, and acupressure. I've been practicing since 2005 and teaching since 2008. Let's get started on the presentation. So we'll go through the presentation, and at the end there will be a question and answer session. So, just exactly what is reflexology? And what areas of the body is reflexology used on? Before we get into those details, I want to take the time to first tell you what reflexology is not. I have noticed with my own clients that there is some confusion about what constitutes reflexology. And some of that confusion comes from other practitioners they may have seen prior to coming to me. First, reflexology is not a foot, ear, or hand massage. Many people are confused about that because if they've gone to a massage therapist, the massage therapist may or may not be specifically trained in reflexology, and they may incorporate hand and foot massage in the session, not reflexology. Reflexology focuses on the reflex endings located in the hands, feet, or ears. Secondly, I have heard people say they have had reflexology on their back. Reflexology is done on the hands, feet, and ears. If a practitioner was applying pressure to certain points on the back area, then most likely the practitioner was using acupressure on that area, not reflexology. And I will be having another webinar at a later date discussing acupressure. Thirdly, reflexology is not considered medical treatment. The definition for medical treatment is the attempted remediation of a health problem, usually following a diagnosis. Reflexologists do not prescribe or diagnose any illnesses or health conditions. According to the Reflexology Association of America, Reflexology is the systematic manual stimulation of the reflex maps located on the feet, hands, and outer ears that resembles a shape of the human body. Reflexology is a safe, non-invasive, natural technique that is easy to learn and use on yourself and others. It is a form of complementary and alternative medicine as defined by the National Center for Complementary and Alternative Medicine, which is funded by the National Institutes of Health. It is also a wonderful gift you can give to family or friends to help reduce their stress, and it maintains the body's homeostasis or balance. And while we focused on doing reflexology on humans, reflexology may be performed on animals, and in particular, dogs and cats. Reflexology is good for many things, but in particular, it is good for lower back pain, chronic indigestion and constipation, headaches, high blood pressure, stress reduction, lessening of pain, and menstrual cramps. According to Kevin and Barbara Kuntz, published authors of several books and who have been practicing and teaching reflexology for over 30 years, there are many research studies that have been conducted, and reflexology creates relaxation from the moment the reflexologist's hands start their work. The relaxation begins as shown in research using EEG brain activity. Research shows that reflexology work helps individuals of all ages with some 78 health concerns ranging from aggressive behavior in children to urinary concerns in the elderly. It improves blood flow to the feet, hands, brain, kidneys, and intestines. Reflexology work aids recovery after surgery, as shown by several studies, reducing pain and lessening the use of most operative analgesics. The impact on physiological measures like blood pressure and cholesterol can be seen. Research also demonstrates that reflexology can reduce depression and anxiety, and it also complements cancer care. Pain, nausea, vomiting, and or anxiety decreased for chemotherapy patients following reflexology work. Reflexology eases pregnancy, delivery, and postpartum effects. Women who received reflexology experienced shorter labor times and used less pain medication. In addition, reflexology showed a positive impact on postpartum depression, anxiety, urination, and bowel movements. So you can see why this technique is so good to have performed on yourself on a regular basis. Better yet, you can learn how to do reflexology on yourself and on your family. Footwork. It's been around for a while. Footwork practices have existed since 2300 BC in Egypt, 2704 BC in China, and 690 AD in Japan. In the 19th century, modern research began to explain the idea of a stimulus, or a reflex, and how by applying temperature, pressure, or some other stimulus to affect a response from the body. This particularly took off in Russia, but was not widely accepted or received by the British or American medical community. The zone therapy was the precursor to our modern-day reflexology, and it was created by Dr. William H. Fitzgerald in 1917, where it was recognized that vertical zones corresponded to areas of the body. In his book, Relieving Pain at Home, published in 1917, he wrote, "Humanity is awakening to the fact that sickness, in a large percentage of cases, is an error of body and mind." Dr. Fitzgerald was an ear, nose, and throat specialist working at the Boston City Hospital, as well as at St. Francis Hospital in Connecticut. He discovered a very interesting fact, that the application of pressure on the zones not only relieved pain, but in the majority of cases also relieved the underlying cause as well. Dr. Shelby Riley added the horizontal zones to the zone therapy. Dr. Shelby Riley was an MD, and he worked closely with Dr. Fitzgerald and developed the zone theory further. It seems that he added the horizontal zones across the hands and feet together with the longitudinal zones, thus determining individual reflexes according to the zone theory. He, like Fitzgerald, espoused continual pressure on the reflex or point of contact. Eunice Ingham, a physical therapist, is widely recognized as the individual who helped spread reflexology to the United States. The Ingham method is the most widely used form. While working closely with Dr. Riley, Eunice Ingham started developing her foot reflex theory in the early 1930s. She had the opportunity to treat hundreds of patients where each reflex point of contact was meticulously checked and rechecked until with all confidence she was able to determine that the reflexes on the feet were an exact mirror image of the organs of the body. Dr. Riley encouraged her to write her first book entitled Stories the Feet Can Tell, where she documented her cases and carefully mapped out the reflexes on the feet as we know them today. There is a distinct difference between zone therapy and reflexology. Zone therapy relies solely, no pun intended, on the zones to determine the area to be worked, whereas reflexology takes the zones as well as the anatomical model to determine the areas to be worked. Reflexology is to be performed on both the feet or the hands. Because the human body is mirrored on the feet and hands, some organs are located on the left side and some are located on the right. For the example, the liver is located on the right side of the body, so it's mapped on the right hand and foot. The spleen is located on the left side of the body, so it's mapped on the left foot or hand. And so this is a picture of the left hand, and you can see where it shows the spleen here. And then this is the right hand. You can see that, and the liver is over here. So that's why it's important to work both feet or hands. So you decided to try reflexology, and you want to make sure you choose the right practitioner for you. There are several things to consider when making your choice.
First, do they have training specifically in reflexology, and did they receive a certificate? Of course, being certified means that they took a course and they received a certificate acknowledging their training. It does not guarantee knowledge base or competence level. Secondly, how long have they been practicing reflexology? Thirdly, how do you feel when you are with the reflexologist? Do they make you feel welcomed and nurtured, like you are valuable and respected? Did they explain their process and advise you of any after effects you might experience? Next, is the office clean and neat? And is the staff friendly and answers your questions? And lastly, do you have a personal connection with your reflexologist? If the answer is no, then you may want to find another practitioner. That personal connection is important to having an enjoyable session. You can still get a good session from someone you don't particularly relate to on a personal level, but why settle for something that is just good when you can have great? When you go in for a session, you should feel relaxed and comfortable. The environment should feel like a sacred space where all of your worries and cares can be left at the door once you enter the threshold. The reflexologist may use aromatherapy oils, candles, nice soothing music as part of creating sacred space. Reflexology sessions last from 30 minutes to an hour, but it can vary due to several factors such as age and the receiver's fitness and sensitivity level. The client sits in a reclining chair or on a body worker's table, placing the feet or hands conveniently for the reflexologist to work. The reflexologist uses pressure, stretch, and movement to work through the foot or hand methodically. Technique is applied to the whole foot or hand and to both feet or hands. You should feel relaxed at the end of a session. How long that relaxation lasts is a good indicator of the effectiveness of the session. So make note of this and tell your reflexologist your response to the session when you schedule your next appointment. Expect the reflexologist's application of technique to be within your comfort zone, not too heavy and not too light, but at a level within your personal preference, and you need to communicate this preference to the reflexologist. Expect the technique application to be dry, without the use of creams or lotions. Use of these emollients constitutes a foot massage and not a reflexology session. Aromatherapy essential oils may be used by the reflexologist either at the beginning or at the end of the session. They may be diffused into the environment with something like this piece of equipment. This is a diffuser. It's water, and you basically put the essential oils in and turn it on, and it sends the essential oil vapor out. Or the reflexologist may put a few drops into their hands, like so, and rub them in before beginning your session. For example, lavender is a good essential oil to use when you want to feel calm. Bergamot is used when you want to feel relaxed but uplifted. And if you are undergoing a detox program, then utilizing reflexology with juniper can help the detox process. That's the end of the presentation. I hope you found this information helpful. This presentation can be found on both Patty's website and my own. If you have any questions, you can choose the Contact Me option on my website at www.spiritualhealthandwellnesscenter.com and send me your questions or comments. Thank you for watching, and I look forward to hearing from you.